Hi guys, pros and cons of working with residents versus working with non-resident teaching hospitals. One of the pros of working with a teaching hospital, you have access to courses, trainings that hospitals that don't have residency programs most likely will not provide. In the ER, you'll have proactive residents that will help you out with putting IV lines, drawing blood work, as well as placing orders. Another benefit is you get to sneak out and get some coffee and get a little coffee break. And also you can stand back and watch the residents struggle putting an IV line. Just kidding. The cons of working with residency programs. Every summer, new residents, just like new nurses that graduate from their nursing programs, start around the same time in June, July. That leads to a high risk of medical error. That is something that nurses need to be aware of, keep an eye out for, because residents that are first year are just starting out as doctors for the first time. And so they're learning on the job. New nurses, you're also learning on the job as well, but you have to keep an eye out for what these residents are ordering. You have to anticipate, and with experience, you'll learn that, but you have to anticipate, what your patient is gonna be getting, what kind of blood work does the situation require, what kind of medications, what to look for in your assessments, just in case the resident orders the wrong medication, the wrong blood work. You anticipate so that maybe if you have to, you can question the orders that are coming down in the system, and you can catch an error before it happens. Another problem is attendings have multiple residents. Depending on the hospital in the city, such as New York City, they'll have multiple residents under them. It slows down the process of communication, the process of orders for these patients, because the residents need to speak to the attending. The attending then approves it, okays it, and then it comes back down to the nurse. If there's a delay or if there's something that needs to be done right away, or if you want to change an order, you have to go back to that resident. That resident will more than likely have to go back to the attending to okay or change an order for you. Okay, the pros of working in non-teaching hospitals. One of the pros is patients get discharged or admitted quicker than they would in a teaching hospital because it's just an attending. There's no residents. No residents means no delay in communication. You're just talking with the attending tells you what they want, it gets done right away. The patient gets sent home or they get admitted right away. Another benefit of non-teaching hospitals is you learn firsthand from the attending. As a nurse, you have to be faster, you have to work faster. You understand, you anticipate what the attending wants, and they usually have their own way in which they work. Versus working in a teaching hospital, multiple residents, meaning they all have very different styles, and it's very difficult as a nurse in the ER to anticipate and understand what this resident wants next. Cons of working in a non-teaching hospital: you have a smaller staff, smaller budget, so it's difficult to have access to better hospital education. Example, I worked at a hospital where the nurse that was teaching all of us that just got started working there had only been an ICU nurse for 2 years, and she was in charge of all the teaching by herself, as well as teaching how to use the EMR, which was, I'm assuming, overwhelming for her, but it just made it more difficult for us to learn exactly how the hospital works. Another con, but it's good for nurses and bad at the same time if you're a new nurse, is you have to know more, and you need to know more faster than a nurse that's working in the residency program. You have to be on your toes, and you need to understand everything there is to know about the defibrillator, about drips. You just have to be on top of your game in non-teaching hospitals. And another thing to remember for you nurses out there in non-teaching hospitals is remember not to let those attendings take advantage of you. I worked in places where attendings thought that if they needed to make a call for a consult, they tell the nurse to do it for them. You have to understand, you have to set boundaries. So just remember, be on top of your game, but do not let that attendant take advantage of you. You can be friends, but don't let them cross that boundary. All right, so there you have it, guys. Pros and cons of working with teaching hospitals versus non-teaching hospitals, obviously with residency programs. If you have any questions, reach out. I'm here to help. Peace.